Hi everybody, happy holidays, Merry Christmas, Happy New Year, all that stuff. I know it's been a little while, and so I just wanted to come on with a general update of everything. Christmas was really nice. It's this time of year is very busy for me at my job at work, and so a lot of the festive family time stuff tends to fall by the wayside a little bit, but I have been doing this job for almost 20 years, so it's pretty normal, and I expect it, and my family expects it, and everybody is fine. So we still had a really nice time and nothing out of the ordinary. So that was Christmas. In terms of weight loss, I am pretty much right where I was before Christmas. I am still sort of vacillating between 228 and 230. During Christmas week, I went all the way back up to 237 on one day. I think that maybe that was a thing with my medication, because I do tend to go up and down in, like water weight or digestion weight. I don't know, a few pounds day to day. That is not out of the ordinary for me or for anybody. But 7 to 9 pounds is pretty big. So I was pretty sad to see that, especially since I felt like I didn't earn it. I stayed pretty good through the holidays. I didn't overeat like crazy. I had a couple treats, nothing out of control. But that high number went right back down in 2 days, and now I am back to 228.2 this morning. So I'm annoyed because I'm still sort of at a plateau, and I can't seem to hit I just want to hit 225 just to get there. But overall, that means that I have lost 35 pounds in 2018, which, when you have over 100 pounds to lose, I know it does not sound like very much. However, I've been trying to lose that 100 something pounds for my whole life. So losing 35 and sort of keeping it off and slowly losing over the year, I'm really pleased with that. I definitely hope to lose just as much, preferably more, in 2019, but I'm not making any hardcore goals or resolutions or anything like that, because I feel like I'm finally eating in a much healthier way. Not healthier in terms of nutrients and whatnot. I feel like I've always done pretty well with that. But healthier in I'm not binge eating. I'm not just going off the rails. I've been eating really well, and that feels good. So that's the weight stuff. I'm still doing the 1 meal a day, which is exactly what it sounds like. It's intermittent fasting. It means that I fast for essentially 23 hours, and then I eat one meal, and I eat all of my calories in that one meal. I have dinner as my one meal, so I come home from work and I have dinner around 6:30 to 7:30, and then I don't eat again until 6:30 or 7:30 the next day. So I eat 1,300 calories a day. It was hard to figure out that number. And actually, it's hard to get 1,300 calories in one meal and have it be healthy. So I feel like I'm really kind of tuning that in, dialing it in to exactly the right amount for me. Because when I started, I would naturally end around 800 to 900 calories in that one meal. And it felt fine. I felt full, but I was not losing weight. And so I did not want to go any lower than that. And so I just started going a little bit higher and trying to eat 1,300 to 1,400 calories a day. And it's just really hard to get that high without really stuffing myself to the point where I don't feel good, or adding unhealthier foods to like fill out the calories, and I don't want to do that either. So I've kind of found a happy medium where I end around 1,200 to 1,300 calories for the day, and it's a healthy mix of food. So that's what I'm going to continue to do. It's certainly it's working, just very slowly, but I will take slowly over not at all for sure. So that's it for my weight loss. For my health and medication update, so 2018 was a pretty big year for my health journey, if you will. I looked at my calendar the other day to see how many doctor's appointments I had in 2018, and the total was 37 doctor's appointments, and that's a lot. At least that's a lot for me. I was previously used to maybe, 6 to 10 doctor's appointments a year, and I am a sicker person. For example, my boyfriend had 2 doctor's appointments in all of 2018. So yeah, but it was a good year in terms of getting stuff done. I mean, I got a diagnosis of mixed connective tissue disease in January of 2018, and then I spent the year trying to confirm that diagnosis, and then also try and perfect the treatment plan for it. So I did, my rheumatologist had closed down his office shortly after I saw him. And that was very frustrating. I waited 9 months to get an appointment with him. And then I was in his care for 5 months. And then they closed his office. So I had to find a new rheumatologist. But it was great. I love my new doctor. He's even closer to my house. And he seems to be a little bit more up to date on new research. And so the first thing he did was confirm that I do have mixed connective tissue disease and not just lupus. Those are my quotes. Just it's not just anything, but I'm not gonna, I'm sure you already know all about it if you have been watching my videos. And he knew about a newer medication called Benlysta that came out in 2011, which for medication, that's very new. And it is created specifically to treat lupus. And so he wanted to put me on that. And the Benlysta goes through either a monthly infusion, which, would go through an IV inserted with a needle into your arm once a month. And I went in to start my treatments, and I made a video about it, but I ended up spontaneously passing out before I was able to get the infusion. and I had to go to the emergency room, and everything was totally fine, but they did not want to go through that again, so they switched me to a different version of the medication, which is supposed to be equally as effective, but it is a self-injectable, the dog is stretching, sorry. It's a self-injectable that I now will take once a week. And there was some small rigmarole through the pharmacy and my insurance and everything to get approved for it and actually get the medication. They ship it to you from the specialty pharmacy, so it was sort of it wasn't a hassle, it was just a waiting period. So I got it, and I have started that now. Today will be my third injection. So the first injection I got at the doctor's office because they wanted to walk me through how to, give it to myself. And it was very easy. It's just like a plastic, just looks like almost like a pregnancy test, like a long plastic tube type thing. And it's got the needle up inside of it. And so you take off the cap and you just hold it very firmly against your body, and you push it down really, really hard, and that releases the needle out the bottom, and it slowly injects the medication into your body subcutaneously. So cool, right? It definitely has a lot of very scary sounding side effects. I joined a group online to talk to other people who are on it, so I could see what to expect, and it's a little bit intimidating, but so far so good. I've been on it for the 2 weeks, and I haven't had any severe side effects. I had a day or two of some very minimal, like dizzy wooziness sort of situation. Sorry, I'm technically working from home right now to give you this little update. I'm on my lunch break, but I'm getting messages from work, so I'm gonna take care of that. Hold on. Okay, you just have to share my attention for like 1 minute because I need to make a PDF of something, and my computer is a little bit slow the first time I try to open this particular program, so I figured I might as well talk to you at the same time and make this happen. So I actually need to go downstairs and take the medication out of the fridge. I do have to keep it in the refrigerator at a certain temperature, which is a little bit annoying because they send you multiple months at a time. So there's multiple boxes of them, and they take up a whole veggie drawer, and my veggie drawer is prime real estate that I need for my veggies. So I may end up starting to keep them in, we have like an extra fridge in the basement that we don't really use. So I might turn that on and just to keep my medication in it. And yeah, so I have to take it out of the fridge to warm up because someone described it to me as it's the difference between injecting cold honey versus warm honey into your body. So it gets very thick and therefore very painful to inject when it's cold, and that doesn't sound that great. In general, it does hurt. It's not terrible. It's not unbearable in any way, but you really want it to be over a little bit faster than it is over. You have to hold it there with the needle in maybe 20 seconds, but 20 seconds can be a very long time when it's just 20 seconds of like a burning pain. So yeah, I think, it really doesn't bother me that much, but I think I'll even get used to it, and it'll hurt a little bit less and less, or it'll bother me less and less as I do it, because it's once a week. So yeah. I think it's going to be at least 6 months before I feel any benefits or see any effects from the medication. They will be able to do blood work and actually tell if it's working, which is very cool because I don't feel like I'm a reliable source for information in terms of how I'm doing. I don't like to really track my symptoms or pain levels or anything like that because I just feel like that requires too much attention, and once I start giving it attention, then it's worse. Like, I don't know. It's like if you bump your head, you're like, "Ooh, I bumped my head." But the first thing you do is like look to see if there's blood. And that's like how you know how much attention to give it. If you saw blood, all of a sudden it would hurt so much worse than when you don't. You're like, "Oh, it's just a bump." So it's sort of like that. It's like I don't want to think about it because then I'm giving it too much attention and then it hurts even more. It's just, psychosomatic, but yeah, it is what it is. So I like that there can be blood tests to very specifically see, yes, it's working, or no, it's not working. And I'm looking forward to that, to see if it is working. Because my main thing, of course, is to lessen my lupus symptoms, especially the inflammation, and then therefore the pain caused by the inflammation. But I'm mostly focused on preventing the bad stuff. With lupus, obviously it can kill you, and it can really damage your kidneys and other organs. And if I can slow down that process, I'll be happy because I will live longer and hopefully healthier. And that's it. This PDF is taking a long time. I feel bad, but what can you do? Yeah, so in general, I've been feeling pretty good. I haven't been sleeping very well, which is in general fine, except that I've also been busy at work. So like, I don't want to miss work, and I don't want to be late in the morning or anything like that. So it's hard to like feel like I can catch up on sleep. But I also feel like I can actually function on very little sleep, but I don't want to. Sleep is important. So the other day I ordered some of these like melatonin drinks on Amazon. They're called like Dream Water or something really cute like that. And I kept thinking, the reviews are really good and it's all natural, and it's I've tried like sleep aids before and they do the opposite to me. They like really mess me up, but they don't make me sleepy. And everyone and their mother was like, "Well, have you tried melatonin? It's, natural and whatever." So I wanted to, and I ordered them, and they came this nice big box yesterday. And I thought I should, before I took one, that I should quickly Google and make sure that it doesn't have any drug interactions with any of the medications that I'm already taking, which I couldn't imagine that it would, but I'm paranoid about that stuff. So I looked it up, and I'm glad I did, because it turns out that melatonin is actually very bad for people with lupus, and also for people who are on immunosuppressants, which my new medication is. So I can't take the melatonin drinks, and they look so cute, and I'm so excited to try them. So I gotta send it back or see if maybe somebody else wants them. And I guess the safest thing for me to try is Benadryl, which I don't really want to try because, for one, I don't think it ever really made me sleepy, but I haven't taken it since I was a kid. But for two, I do have the mixed connective tissue disease thing. One of the diseases is Sjogren's, which means that I get like a dry mouth, and it really only affects me at night. I'll like wake up with a really dry mouth and it's like hard to swallow. And I feel like Benadryl is sort of it's like an antihistamine, right? So I feel like it might dry everything out like other antihistamines do. And then I'm just gonna kind of like turn to dust and implode on myself in the night. But at least I'll be sleeping, so maybe it'll be okay. I don't know. But I might try it just for like those nights that I really can't seem to sleep, because your girl needs to sleep. That's just how it is. All right, well, I'm still waiting for this PDF, and I don't want to keep dragging this out for you too long. I am going to say goodbye, and thanks for listening to my update. I should have hopefully a more fun video. I think I'll get another Dia and Co box soon, and we'll see what is in store for that. And yeah, if anybody is actually watching these, besides my one friend, Melissa, thank you for watching this, Melissa. Please do, for real, leave me a comment or send me a message and tell me if you like any of the videos that I make, and if you do, which kind of videos should I make? Do you want just the weight loss stuff? I can do even more with my actual meals and more weigh-ins, or food stuff, vegan food stuff, health stuff. I'm also doing a lot of house stuff. I know you can't tell from this mess in here, but we've been doing a lot of home improvements. And, you know, or if you just want the fashion stuff, I can do even more fashion stuff, because I love clothes and I got a ton of them in there. All that stuff, makeup, whatever. I'm not particularly good at anything, but I do like making these videos, and if anyone has any suggestion as to what you actually like, I would be very happy to do it. So that's all. That's my whole spiel, and I will definitely talk to you again soon. Bye.